Good afternoon and welcome to Worcester Business Journal's COVID-19 webcast series. I'm Brad Kane, editor of the Worcester Business Journal. And no, I am not shooting a hostage video. I'm coming to you from my basement, the only place in my house where I can hide behind a locked door and filter out some, but not all, of the noise from children and dogs. In today's webcast, we'll be talking about survival strategies for the nonprofit community. Our panel of local nonprofit leaders will share their thoughts and insights on how their operations have changed and how they are forecasting the rest of the year. This webcast is part of our Coping with COVID-19 Business Strategy series, brought to you with the support of two of the region's leading organizations who have stepped up in many ways at this time of crisis, Fallon Health and Webster 5. Through their support, we are making this session and the entire Coping with COVID-19 webcast series free to all participants. Joining us today is my co-moderator, Tim Garvin, who is President and CEO of the United Way of Central Massachusetts. And our panelists are Angelo Boville, President and CEO of the Essentia Care Alliance, whose organization provides a variety of services for children, families, the mentally ill, and the immigrant community. Troy Seibels, President and CEO of the Hanover Theater for the Performing Arts, which has become a leading cultural institution in the city and is a driving force behind the downtown revitalization. Linda Cavioli, Executive Director of the YWCA Central Massachusetts, whose organization, among many, many other things, has expanded its domestic violence victim services and is in the middle of a $24 million renovation. And lastly, Stephen Kerrigan, President and CEO of the Edward M. Kennedy Community Health Center, which, like all health centers, has been in heavy demand due to the coronavirus, and in particular, serves the low-income community. Tim will help guide this discussion. In addition to the questions we have prepared for the panelists, please feel free to submit your questions in the Q&A box you see at the bottom or top corner of your screen, and we will do our best to get to as many of those questions as possible. Additionally, this webcast is being recorded, and the link to the recording will be made available to you shortly after the broadcast. Tim, I'll hand it over to you now.
Brad, thank you, and thank you to the Worcester Business Journal and to Fallon and to Webster 5. We are thrilled to be here. I am personally thrilled because of these four great panelists. A 20-second state of the state. On March 12th, March 13th, March 14th, things changed. They changed for all of us. And we went from regular service to how do we respond? How do we continue our services? Finances have gotten difficult, philanthropy has shifted, and yet we've all remained open and serving an even greater need. Perhaps the best quote I have heard yet in these 2 months of the coronavirus is from our Congressman Jim McGovern. I heard him say this last night at the Greater Worcester Community Foundation annual meeting. He said, during the worst of times, we are seeing the best of America and the best of Worcester. And I think that's perfectly befitting of where we are. A very short piece. I think everybody knows, I hope everybody knows that the United Way and the Greater Worcester Community Foundation have merged and are partnering on our response to this. We have been able to raise in these 7 or 8 weeks over $6 million. In phase 1 of immediate needs, we've granted more than $1.5 million, and we continue this work together. In addition, there is a response team that meets every Monday and Thursday with upwards to 100 people in everything from culture, clergy, housing, food, education, childcare, and a whole host of others. Everybody is invited to that. I am thrilled that Chris, who is doing all the behind the scenes work for the Worcester Business Journal, has put up helpful resources for nonprofits. I hope all of you take a look at this. I hope you use these resources so that you can survive during this nonprofit time. The last point, we want this to be as much a question and answer as really a conversation that will have value for all of you as we are in the midst of this virus. So with that, I am going to ask our panelists very quickly to say, when this hit, how did it affect your service and what did you do? Linda Cavioli, I see you first, so if you'll answer that question.
We literally, thanks Tim, we literally had to turn around from traditional childcare to emergency childcare to respond to a consortium of agencies that were working with UMass in less than a week, with all of the concerns around staff safety, protocols, screening, with our licensing agency being the first to put some new regulations out. And frankly, we did it without with any funding promised. And then the second thing we did was we closed our health and fitness center and moved to remote. And then the second essential service besides childcare was domestic violence, where we had to be able to position our advocates to be able to be safe, but respond, run the shelters, run the housing programs, and get food, counseling to those who needed it most. So it was a 24-hour to 48-hour turnaround.
Thank you, Linda. Troy, the theater and the conservatory, how have you responded?
On March 12th, we had a performance that night, and around noon that day, it became clear that where the storm was headed, if you will, and we canceled and rescheduled our performance for that night, and have since rescheduled everything after that for the next several months. On the other side, on our conservatory classes, we shut down for about a week, and during that week, we retooled and we opened again 1 week later with classes live online. So all but a couple of our 70 classes, so there's still 500 kids a week we're still serving every day. It was about finding what pieces of the organization we can keep open. The theater that we did shut down, we did so before the state mandated that we do so, because it was clear that it was just the right thing to do.
Thank you, Troy. Angela, your answer.
Hi, Tim, thanks. So we have a pretty broad agency that serves multiple states. And so the answer to your question is sort of, it depends on what program you're talking about. But for the vast majority of the work we do, we still have to do it. Just like the rest of our friends in human services, it just got harder. So we had to figure out more immediately how to keep people safe and how to figure out how to get personal protective equipment to people in rapid fashion that are not used to dealing with it. Certainly our nursing homes were used to dealing with it, but most of the rest of the organization was not. So things like our group homes, our teen living programs, foster care, all the other things that we do, we had to figure out how to convert to a whole different way of doing it very, very quickly. So that was a trick in and of itself. We had to make decisions about keeping our offices open or closed, and how to convert our classrooms to being online classrooms or doing any of the number of things that we do remotely. So it's been interesting to try to convert as quickly as we can, with only a couple of exceptions, like in our Good News Garage program that provides rides where everything is closed. There's no place to go to. So in some cases, we had to furlough some of our workforce. But thankfully, of our 1,800 employees, we've only furloughed about 50 people temporarily. Most everybody else is still working, albeit under much harder conditions.
Thank you, Angela. Keywords that I've heard: rapid, continuity of services, finances. Steve Kerrigan, in the healthcare field,
Yeah.
how have you responded?
So we started planning probably in late February for some sort of impact to be felt from COVID-19. We didn't quite know what it was going to be. And as you pointed out, Tim, around that March 12th, 13th is when you really knew it was coming. We immediately moved as many folks remote as possible. It did take some time. Our behavioral health folks went remote first, and within one day, all of them were working remotely. We saw no reduction of services there, and long-term we've actually picked up on visits. All of our sites, we immediately set up tents in our parking lots to do screenings, to protect our patient population and our staff, but also to check folks before they go in the building, see if they have any symptoms, and work with our partners at UMass. And we're also in Milford and Framingham, so the regional hospitals out there as well. We got the remainder of our staff out working remote who could, and reduced our clinical procedures. We do not have optometry services currently. Our dental procedures are limited to emergency and acute cases only due to the aerosolization that comes with a lot of dental services. And for medical, it took us probably a week to 10 days to move to just acute and urgent care in our sites, and the remainder of it to be done remotely, and that has worked incredibly well also. So we've been lucky. We were able to turn operations remotely and to focus the ones that are on our site on the immediate emergent need of dealing with the COVID crisis with our population pretty quickly.
So a quick summary: 4 very different organizations, all continuing services in response to because of this virus over the last 2 months. I think adding value to all of our webinar listeners and watchers, how have you managed the finances? And Troy, I'm going to come to you first, and then Steve, and then go up the line. So Troy, you're up one.
We have a lot of very generous supporters out there. We had recently completed a capital campaign. We went out to those who had contributed to that campaign and got their permission to repurpose some of those dollars to keep our doors open during this time. We applied for a PPP loan through the SBA, so there is a component of the CARES Act that's benefiting us. There are a number of things that we've done on our own. And I said our conservatory is opening and it is still operating and bringing in revenue there. We've been able to retain all of our salaried employees to date, and we really want to prioritize our own team as we go forward. We know that may be tough in the long run, and our main goal is to preserve the future of this vibrant institution. And so in the short term, we've found the dollars that we can, and sure, it will have some impact. We can't do the capital things we wanted to do with the dollars we raised because we will have spent them on this, but clearly our priority is protecting the institution and the people.
Thank you. Steve, right back to you.
So we were, so as a federally qualified community health center, there are 38 of them in the Commonwealth of Massachusetts, 1,300 and some across the country. We have what you call a PCA, a primary care association, called the Mass League of Community Health Centers, a fantastic advocacy group. They have an office right here in Worcester, and we love them. We had been preparing for months and months an analysis of costs per health center. So when this hit, we were able to talk to our national partners at the National Association and to our congressional delegation, who've been fantastic, to talk to them about the real costs, not estimates, the real costs to keeping community health centers functioning during this crisis. And then we were able to tell them what a 25% reduction in revenue would be, 50% and 75%. We were assuming we were going to see a 50 to 75% reduction. That was able to be put into the earliest of legislation and successive pieces of legislation, and it really helped us. So we've received a lot of financial assistance from the federal government. We have obviously also have great generous supporters who have been fantastic in the Worcester area and around the whole Commonwealth. But it was having that information and being as prepared as we were that I think allowed us to turn to Congress, give them as much information as possible, what is at risk for the 28 million Americans who get their health care in a community health center. And we think it frankly helped because we were better prepared, Massachusetts was, to help the whole country. And so that's what funding has been difficult. We have lost about, not as bad as we thought because of some of our remote work, but about 35% of our budget revenue lost is lost every month, which is a significant amount of money. And we're just keeping on. And I will say, just like Troy, we've been lucky enough, we've redeployed staff. So some of our dental staff are now traffic workers in our pharmacy to make sure no one's standing too close to each other. Others are doing contact tracing with Partners in Health. So we have not furloughed or laid anybody off. We've been able to keep everybody working and frankly keep the productivity up as high as possible.
Thanks, Steve. Angela, to you.
So clearly the economic impact to all of us is dramatic. Thankfully, the majority of our revenue is intact, but I would say the biggest problem is that we all operate on very tight margins. And so if you start taking the edges away from the revenue and you start increasing the cost, which is exactly what's happened between the cost of labor, which is frankly skyrocketed, especially in the nursing home sector, paying incremental wages for people to work in high risk conditions, as well as incremental costs of PPE and other costs, have really put a lot of strain across the organization that way. The federal government, certainly the CARES Act did provide some relief, and the states have too. Some of the state contracts have stepped up. Massachusetts has in certain categories, other states have too. I think the risk in the short term, as others, we've been able to retain all of our workforce with the exception of some temporary furloughs, but so far we haven't laid anybody off and don't expect to because the work continues to be higher than ever. As a matter of fact, coming out of this, the need will be higher than ever. I think the worry that we have is the sustainability of the problem, and the needs are high, but the funding's temporary. And that's true whether your funding's coming from charity, it's true whether your funding's coming from temporary help from state or from federal government. My biggest concern financially is that the coronavirus and its related impact is going to last a long time. The funding will not. And so I worry about the wear that it will have on the organization over time, not in the immediate future, but over the course of the next coming months. I have a high concern about the mismatch of the timing of funding and the actual impact on organizations. It's going to take a long time to recover from hits like these.
Thank you, Angela. Linda?
For the YWCA, we made commitments early on to keep people working and paid. And we were able to come true on that with the PPP Act. So we were very much benefited by that. And we have been very generously supported as well. But 40% of our income is from private fees for service. So that is the worry that we're still trying to figure out how to bring that back. So one of the concerns and reasons to keep people working and keep people paid is to keep our outreach to members, participants, our vulnerable populations that we were not going to be able to see face to face. And then the additional costs, as everybody said, around cleaning, even more so. One of the other areas that's of great concern is coming back in the early care and education field. We've been operating in collaboratives and consortiums to service essential employees, but we have parents who may not be healthcare workers, but who need to know if they have access to childcare and, in fact, how we're going to pay for it. So the state's been incredibly generous to continue our contracts. But if you're a private pay, if you balance your income between private pay and government sources, that's a real concern. So coming back in early education and care, which we've been able to do hazard pay during this period of time, that can't continue. If the child care field comes back half of what it was, enrollments is how we live, and servicing parents that way. So in the long term, I think we can get through the summer, but reigniting our services and tooling up to whatever the new normal is going to be in terms of enrollments and numbers of children in different types of service programs is a great concern moving in the next fiscal year.
So my quick 5-word summary: repurpose, flexible funding, the support of our legislative leaders through the CARES Act and perhaps now the HEROES Act, generous donors, long-term concerns, and sustainability of this. But I think that's a perfect lead-in for, so what's been innovative? What have you done that's different that you hope to continue going forward? Angela, we'll start with you.
The thing that comes to mind right away is one that may surprise people. I think that one of the things we've done, or one of the silver linings, is we're learning how to communicate better and faster, internally and externally, to keep people on board with what's happening, because the change is happening so fast that, frankly, the list of innovations and the list of things we've had to change is longer than this call would ever allow us to go through. So we've had to make changes in the way we make decisions, and we've had to make changes in the speed at which we can convert or pivot, as we were talking about the other day. I think that's been the biggest change, and in a way that's a good thing, because it's forcing the organization to work together in ways it hasn't had to in the past. It's forcing us to make decisions in rapid fashion and assess risk very, very rapidly and communicate frequently, whether sometimes a little more frequently than any of us might even want. Every single day meetings of leadership team and the entire leadership team across the organization meets every week, virtually, of course. But I do think that it's fueled a lot of rapid fire innovation, a lot of rapid fire changes that would not have been possible otherwise.
Thanks, Angela. Let's go, Troy, same question. How have you innovated? What's new? What's different?
Everything's different.
Yeah.
90% of our revenue was gone overnight. We are, the things that everything we've done has changed completely. So what's the silver lining in those? What are the pieces of those that we might keep going on? teaching conservatory classes online is not something we would continue forever, but it has introduced us to some technological things that we can do that would help if a student can't be there, or tools that we could use that for. Communicating, I think we've done okay communicating as a team, but what it has done is it's given us, if anything, a closer communication with some of our audience, which seems really ironic, in that they're not coming through our door. But we've taken a lot of staff and repurposed jobs to having people on the phone, calling from their homes to the homes of our subscribers and members and supporters who are coincidentally sitting at home waiting for the phone to ring, and really prioritize letting them know where we are and how we're doing, and asking how they're doing. And I think that connection is really important and something we'd like to keep.
How strange that in this social distancing, we're actually getting closer to people. Steve Kerrigan, same thing, innovation. What's new?
Telehealth. So we telehealth and by extension remote working, but the healthcare community has been pushing the government to approve telehealth from a reimbursement rate, from a policy perspective, for quite a while. And of course, I come from government and I love it. Sometimes it takes a little while to come up with new ideas. They immediately greenlit the use of telehealth in the wake of this crisis, and it has made a huge difference. We're seeing 120% of our behavioral health visits that we had on budget, we're seeing 120% now because of telehealth. We're able to do a lot more calls with people, and there's a lot of anxiety, right? Particularly around healthcare in this time. And so someone being able to pick up the phone and talk to their PCP about a health concern they have. Frankly, we had been doing through partnerships with 3Derm and others, Telederm for a while, where you can take an image of a dermatological concern and send it in for an assessment. So we're continuing doing things like that. But like the telehealth component, which is something I echo every time I talk to the governor or our congressional delegation, cannot be rolled back, because it is creating for us a huge access portal for our population. We have, almost 29,000 patients we see every year that speak 80 to 90 different languages. Creating an opportunity that doesn't intimidate them, like showing up at a health center during a health crisis, allowing them to continue to get their primary care. We've sent out, I couldn't tell you how many, blood pressure cuffs, and we're now sending out pulse ox machines to folks who are in high risk things with diabetes or hypertension, whatever, teaching them how to take their own vitals so that when they're having a telehealth visit, they can report that stuff in. And when this crisis abates, they'll be able to continue to monitor. So we're really hoping that telehealth is a big piece that will continue long after this crisis abates.
Thanks, Steve. Linda, I know there have been some amazing innovations happening at the YWCA.
Yeah.
What are they?
Well, besides the fact that we have learned how to do childcare in a very different way, and that now they're going to require preschoolers to wear masks, the youth serving agencies are trying to figure out how to do our summer programming, because 3 months out of school, the school year slide, now, we know there's a summer slide. So the collaboration across services has been incredible. So yes, we had a Youth Connect collaborative, but we've managed to get childcare and youth together to put together a consortium to meet healthcare needs, early care and education. So we're open holidays, and like I said, we did not lose a day of service. The other thing around is what I think Troy said, outreach. We have reached out to every member, every participant, and having more communications with people that we sometimes saw face to face. So the proactive outreach, we have now become a significant food supplier to all of our members who need food that we did not do before, our teens, our youth. So we've come into other services. But one of the most exciting things I think that happened was, as you bring together the community every Monday and Thursday morning, and the reports come out, it became very clear that a housing program, a shelter for women, was absolutely needed, because women that have trauma were not able to be served in the city's response to housing homeless people and serving them during this pandemic. within 72 hours, agencies that do work together, but not this closely, Abby's House, YW, Lyft, City of Worcester, and everybody else came together and opened a 10-bed shelter specifically for women with trauma-informed staff and volunteers, because that was the other thing. Volunteers who were all good souls were not able to serve with trauma-informed care. And these women were full of trauma and even more. The other thing is what we're finding is in the area of domestic violence. So it's really had us have to look at things differently. We respond to a hotline and a chat line, but as we're doing our proactive outreach, sheltering at home with some women or victims in battering situations is not the best state of what needs to happen. So really trying to problem solve safely, safety plan with individuals that we never had contact with before, who are trying to maneuver this sheltering at home in substance abuse or domestic violence situations. So we have relied on our partners who have some of the expertise we don't to really make the referrals matter during this time.
Linda, thank you. The line that I keep on coming back to is crisis is the mother of innovation, and I really believe that. Brad, we've spent half an hour. I can't believe it's gone so fast, and I know we have a good 100 people on the line. If they haven't asked questions, this could be a good time, or if you have questions that you want to jump in on. I still have a series of questions. We're just getting warmed up, but I want to kick it back to you.
Yeah, Tim, we do have a number of questions that were sent in both in advance and then they are starting to trickle through. But I'll be selfish and ask one that kind of came up in our discussion as we previewed this yesterday. And Angela, I'll direct it to you first, but I think everyone can follow through, which was for everyone, nonprofits, for-profits, everyone, you have way more questions than answers right now. You don't know what tomorrow will bring, much alone what 6 months from now will bring. And your concern is you have this huge increased demand for services. At the same time, you got to worry about the long-term survivability of your organization. So as you're feeling your way through the dark, essentially, and trying to answer questions that have no perfect answers, what has been your guiding light? Like, what's the one thing that you're just drilling down on that is probably the message that you want to give to everyone out there, regardless of what their organization does?
It's interesting. The word that comes to mind, or words, is keep the faith. And I know that sounds kind of cliche or something, but the work we do matters. And staying focused on that work and the delivery of that work and believing that it's going to all work out in the end. I know that really sounds Pollyanna-ish. It's not quite that. But I think it is important, because the one thing that's going to cost us the most is if we stop believing it's possible. And keeping our leadership team chin up, head forward, really looking at it and mixing back and forth between focusing on the emergency of the moment and then shifting resources to, okay, so how do we plan for what it's going to look like when we come back online? What things are permanent changes, what things are temporary changes. So really focused on rapid planning, high communication, but like I said, more than anything, staying positive and really looking for the silver linings that exist in all of this, trying to find ways to turn bad things into good things and extracting that forward. I'll make no joke, there's a lot of risk. And if you thought a lot about it and that's all you thought about, you probably wouldn't leave, I can't say you wouldn't leave your house because none of us are doing that. But you might not even leave the corner of your bedroom and your thumb might be stuck in your mouth because it's pretty overwhelming. I looked at some forecasting that we had done. We did some, risk-rated forecasting with, low risk, medium risk, high risk. I looked at the high one for about 10 seconds and I closed the file and I was like, nope, not staying there. Yes, I see that, that's ugly, but I'm not staying there. And I do think that's super important in all of this, is just continue to focus on the work that we have to do and to believe that this is possible, because otherwise it's going to get ugly very quickly.
I want to jump in here. Sorry, Brad. I know you didn't ask me, but the thing for me is that in the YWCA's work of race and gender justice, the fact that unfortunately this pandemic crisis has pointed out of the disparities the disparities that were always there in healthcare, in access. And it's like some people are saying, oh, really? I didn't know that. Well, now it's pretty darn clear that now the whole country knows. And, you know, racism is smack, and how we deal with it as a city and as a country, to me, is a silver lining that could come out of this. That people who have always been left behind are really being spotlighted to be, and it's proven that there's a disparity. The other thing is the lowest paid employees are childcare workers. And the fact that childcare has been labeled essential, and that that when I first went to the childcare staff and said, we're going to open emergency childcare to serve healthcare, first responders. I mean, I was like run out of the room. What do you mean? That's unsafe. And I says, well, if frontline workers need to take care of all of us, then we have to take care of frontline workers. And so when they became, I mean, they also almost became proud that they were essential employees, because they never felt like essential employees based on pay and how they were valued. But I got to tell you, those are the two things. It may change the look of some of our human service workers, because humans, I mean, they get such a bad rap, but this has brought out that frontline human service workers are essential employees. And I don't think they've ever been looked at as that before.
Yeah.
Sorry, had to do it.
I'm sorry, Linda.
No, I had to say it, because those are things that I think have been risen and shine the light on.
Yeah. Could I jump in there too, Brad? I think, you know, I'm the arts guy with the fancy background here. So stands out. It seems tone deaf to the need on the street, sort of. But for us in the arts community, I think we just have to remind ourselves that what we do matters too. The arts are transformational, and our institutions are transformational for the city, and they drive the economy and jobs. And I think that it is hard to, it's hard to look around and say, I want, you know, I'm more important than that over there. And we are, as a society, going through a lot of need right now. But as a society, we're standing up too. We have gotten more generous as a society because of this crisis. And so if we can retain a little bit of that awareness of the nonprofit community, I think that is definitely a silver lining.
Yeah, why not? So we've been pushing the importance of community health centers for decades. I worked for Edward M. Kennedy, the senator, before I ran the health center. And it was a cause of his life, was to improve healthcare access to everybody. This is, I echo what everybody else said about the light that's being shined on human services and healthcare workers. You know, health centers provide healthcare for 28 million Americans right now across the country. 27 million Americans have lost their healthcare due to job loss in this COVID-19 crisis alone. And so what I told my team at the very beginning of this was, our motto and our mission has always been to help people live healthier lives, but we were made for this moment. Community health centers were made for a moment like this, when lower income, poor citizens and non-citizens and neighbors and friends and families are hit with an unbelievable crisis in their life, and they need care. That's what we do. It's at the core of our values. It's the core of what we do. And so my job every day, as I say to them, I said this to them before the crisis, and I said it to them earlier today. My job is to help them do their job as best they can, give them the resources, the tools, and the support. And they are really doing an incredible job. But I do believe that what's helped us through this crisis has been having a clear sense of our mission, our values, our principles, and clear communication during this crisis has been critical to our patients, to our staff, to the community. And I want to applaud Worcester Together for getting everybody in the region together so that everyone's hearing the same thing at the same time. Everybody's coordinating. Everybody's coming up with problems that need solutions. We reactivated some access to our school-based health center at North High so that we could provide healthcare to the homeless that are being housed there right now. I mean, all of that comes from this community that has always been so wonderful at the heart of the Commonwealth, working together and talking with each other. And I think this is really I agree with the quote you had earlier, Tim, of what Jim McGovern said last night, that this is really, Worcester is really shining in this moment.
I would like to add just one other thing, and I think it speaks to the four of you and really that much larger nonprofit community. All essential workers, healthcare, culture, housing, food. But I think what we've also seen is that the nonprofit community is in fact an economic driver of our entire community, and how many people we are continuing to employ who are spending their dollars 2, 3, 4 times, who are helping that small restaurant or that bodega down the street so that they too can stay open. And I think that's a beautiful spotlight, especially in this survival strategy for the nonprofit community, to understand the importance of this as an entire sector.
Yep.
Brad, back to you, or I've got another if you want me to.
Well, I did want to get a little bit to the audience.
Yes.
We're sending a decent amount to throw in, but one that was sent even before the meeting, and Steve, I know you just wrapped up, but I'm going to throw it back to you about major fundraising events. You guys all still have financial needs. Linda and Troy, capital campaigns. Steve, I'll throw it to you first because I know that Edward M. Kennedy was planning, I don't know if it's first ever fundraiser, but a major.
We were planning our first ever costume party that was supposed to take place. God, I think the original date was in March. And then we got a date in June, and now we have a date in the fall. But it's been great. We actually were doing it because Ted Kennedy's favorite things were his birthday and costume parties. Loved them both. And his birthday is in February, so we thought we'd plan something and then really sort of roll out our health center in the community, talk about funding the need, really getting community members across the region to understand a little bit more about who we are, what we are. The community health centers aren't just for folks who are lower income and poor, but for everybody. And then we play a larger role in the community. So we have been able to pivot. Every one of our sponsors who have been fantastic, and many of them may be on this webcast, have been fantastic, allowing us to continue to move that sponsorship. And now we shifted it to a new fiscal year. But we also have a run walk that we do right around Great Brook Valley Housing Complex every June. The first Saturday in June. We are doing a virtual version of that, which is actually going really, really well. And people can check out our social media to find out how to register. But it's like $5 if you can. If you can't, it's fine too. But it's another way in this crazy stay-at-home time where people who are safely distancing with each other can take a walk and do something purposeful for our community and try to get a little exercise while raising a little money. But nimbleness has been important, not just in operations, but in how we raise our resources, because we were so close to being able to have our first big event, and then it was a couple weeks after everything hit and we had to cancel. So we're glad to keep postponing it. I told everybody we're going to keep postponing this until we can actually have it. We're never going to cancel it. We're just going to keep postponing.
Linda, maybe you want to jump in next on fundraising in general or events?
Yeah, I think everybody should plan a $24 million renovation in the middle of a healthcare crisis. So I think that we closed on our project on January 31st. And I think if we didn't do it on January 31st, we would not have been able to put all of the financing and investment together. So I thank the Lord on that. And then when Boston closed down all of its construction, we thought, oh yeah, here we go. Every time you're a day over, it's cha-ching, cha-ching. But because we are a essential service provider and we're doing housing and childcare, our construction project has been able to continue. Although different, we still have to end it on time to spend the money, but we're still trying to close our capital campaign. We still have $2 million left to raise, and every donation we're getting, thank God, but it's for COVID. So it has been the biggest learning experience, how to understand if a union, and we're an all union shop with a totally women run construction team, that there were work stoppages and materials. But someone said you have to keep the faith, and we've had more good luck than bad. But it's really pulled everybody together. So again, You know, we used our mission to drive our financing. We used our mission to drive our workforce, and it's all becoming a reality. I don't know if December, and we're also 135 years old this year. So the big events that were coming with the end of construction, we may be 138 by the time we can do them. But, and
We'll still
Troy,
go.
yeah, but Troy, I wanted to say something about the cultural community. You know, everybody says, how are you taking care of yourself? And that's what's missing in our community now, besides the events where everybody gets together, the kind of, you know, feel good programming and services and activities that are not happening. And our youth, you know, the cultural infusion in our youth and youth programs is missing. So it is a totally vital part of the nonprofit sector to everybody's mental health and socialization. And we can't wait till you're back on stage.
You know, I was on a call. I'm sorry. I just want to throw this in because that resonates with me. I was on a call yesterday with a promoter from South Korea, and who's got a production of Phantom of the Opera that's been running in South Korea consistently. And that country didn't shut down its venues. Well, they're quarantining people that have the virus, but they are not social distancing. They say social distancing is a tool. It's just not the tool that we used as a country. And if you look at where they are with numbers, it's pretty impressive. COVID-19 has had a huge impact on this country, but social distancing is really what has had a big impact on a lot more of us in a lot bigger way economically. And those two are not the same thing. That's not the only way. I think if we can evolve as a country and make sure that there are ways to pursue the ways that there are to fight this health crisis and yet not prevent us from coming together as a people, then I think that there is an end in sight.
So I'm going to jump in. And Troy, to what you said, I think it was 2 days ago, there was an op-ed in the Washington Post, and they used a term I had not heard before that I think we were going to hear for a long time. The pandemic generation, pandemic generation. And I think what's happening to our kids, to our seniors, to all of us with social distancing, that's very real. What I want to ask is, and I'm on both sides of this, is especially when there is social distancing, when there's shelter in place, when we're working on better communications, how do you keep your funders engaged? And Angela, because you didn't answer that last one, I'll allow you to go first and then we'll work around the room.
So interesting, funder engagement has actually been, much like what I was talking about earlier in communications, it's actually been better in some ways. The downside is you can't bring them to your facilities. You know, all of our facilities have been closed off to visitors for quite some time for obvious reasons, but it's forced us to find new ways to communicate, new ways to engage, new ways to partner with them. I'm pleased generally that the foundation community in particular seems really interested in trying to find ways to help. I think, to be frank, it needed a hard change anyway in the foundation community. And so this, another piece of silver lining in this crisis might be that the foundations seem to be more willing to talk and to listen and to understand how they can partner better. And understanding that, you know, the old way of applying for, you know, grants and specific things is not necessarily the most helpful to us and might be rather cumbersome. And it certainly has always been that way, but now they seem more open to really listening and partnering and figuring out ways to get through this crisis. So in a way, on the foundation side anyway, I hope that some of these changes will be permanent, that some of these ways that we're connecting and communicating and that they're getting a sense for what it is we really do in a different way. And to Linda's point earlier, they're getting a sense, actually all of our funders are, whether that's, you know, individual donors or otherwise, how important the work is and what would happen if it wasn't there. You know, I think a lot of people take this whole sector for granted, including the arts, that they just assume that we're just going to be there or we'll figure out how to make up the gaps. But when the reality of, wow, we might not exist, you know, if there's a tangible, real assistance, and that's still true, by the way, I have to take this opportunity to throw that plug in. This battle is not done. And while we're all sitting talking today, I have real concern about the viability of the sector long term and the energy and patience and willingness that funders will have to go through the whole ride, not just part of it. So I just wanted to put that out there because I think that's going to be important for us to survive this.
From Angela, let's go to Troy on this one.
You know, I said earlier, we have a lot of support in the community. A lot of those are people who don't think of themselves as funders or philanthropic. We had a lot of people donate their tickets to the shows that we canceled and they couldn't come to. Those aren't necessarily people who think of themselves as philanthropic. I think that we are more aware of the need around us, and if there's ways we can support it. As an organization, we're trying to acknowledge that we have support out there, whether the person made a donation or bought a ticket or enrolled their student in a class in our conservatory. That person is a constituent and a supporter of us. And so we need to value those folks in the similar way. They're investing in us as an organization. And I think that fundraising is more broad now than ever. Everyone out there has the ability to be supportive of each of our organizations, whether they're a person who can buy a ticket for $10 or a foundation that can make a $10,000 gift. And I think the intent is equally important behind each of them. And we just need to be broad about it and let people know that everyone can make a difference.
Troy, I totally agree. I've often felt that person during our United Way annual campaign who makes a $1 a week donation is not just donating, but they're exercising their civic responsibility to be engaged in the community. And they are as important as the $10,000 donor. And personally, I want all of them. Yeah. Steve, how about you? And then Linda, and then Brad, back to you.
Yeah, our communication with our donors have been great. You know, it's we've had them reaching out very early. I agree with Angela's point. There's been a lot more flexibility relative to grant applications and whatnot. But we felt very strongly supported both here in the Worcester area and then also in Milford and Framingham. It's been good support, and it is really. I mean, we're a little bit different in that we're doing testing and day-to-day healthcare in a very acute way. So people have I think because we're more in the news, it's easier for them to understand what we do, but we want them to understand that that's what we do every day. And that's the critical role that we play in the community every day. And I want to go back to an earlier point. I do think, and I agree with Troy that there are levels and degrees. And I think that's one thing that we have not had good communication on is how we are to deal with these crises. But just from a healthcare perspective, I am thrilled for all who have been responsibly social distancing, because it has a huge impact on who comes into our health centers, who ends up in the emergency rooms, who gets sick. And so we're going to continue our operations no matter what happens on Monday with new regulations. We're going to continue our operations next week and weeks after that as they are today until we know an awful lot more about what's coming next.
Linda?
The communication, I mean, it's forced more. But for some of us, the old dogs, I'm the white hair on the call, face-to-face and relationship building is not by computers. So I think that, yes, I think social media and all of that communication has made some things better, but I know that I'm not a remote worker. And I know that for many of the staff, yes, we could move people somewhat remotely into their homes to do the work if we could get them technology, which we don't. Most people are relying on their own technology. So I think that there needs to be some real thinking about how to support people who are at home, not able to do whether it be cultural or health and fitness or those kinds of things. I think that that's something that we still are trying to learn. Because yes, many people can work remotely, and we're going to have, as you said, Steve, we're going to have to continue, whether it be because construction, we put our whole building under construction because it was closed for the most part. How do we, how do we reopen? That to me is our biggest challenge right now. How do we reopen responsibly? taking into account people's fears. We were talking on the youth call today, we're figuring out how to do summer youth programming, but a parent's going to even want to send their children. What are the safety and health messages we need to send home so that parents will let their children get engaged in their community again? So, I mean, I think that there's been so many wonderful things that have come out of this tragedy, but I still think that we still have a lot to learn, and we need to think down the road, but I'm trying to think of the next month or two as to how to bring people back into work, if you do, and how to continue to serve people in a summer, which is we're a seasonal operation as well. How do we retool not just remote or different services, but in a different season of the year?
Thank you, Linda. Brad?
Yeah, another question from our audience. This is a very specific one, but I think, Angela, because I think I heard you answer it before, I'll ask you first. Did the CARES Act change the tax treatment of charitable donations for 2020 or beyond, and how might that impact your operations?
So yes, it did. And many of us know that the tax treatment and changes from the prior 2 years have negatively impacted fundraising. We're hoping this might actually offset going in the opposite direction. It is a temporary change that has been made so far. We hope that they make it permanent. The change is that if you do not itemize, you can actually get what is effectively a reduction in income at the top. So it's a direct reduction, which wouldn't normally happen, so that you can actually deduct up to $300 even if you're not an itemized filer. That's a good thing. The other thing that they've done is lifted the limits pretty significantly on those who do itemize can actually donate more this year than they could normally ever and still deduct it. So those are both good things. I don't know that they're enough, but they're at least a start, and we hope they continue. I know, Tim, you had a comment on that earlier. You're hoping those stay as well.
And Angela, that's exactly right. And I would reach out to the entire audience, close to 100 people, and all of you. I know here in Massachusetts, our entire delegation believes in a tax code that preserves the charitable deduction. Yeah. But if any of us can reach out across state lines, if we can show with philanthropy declining the last 2 years because of that change in tax code, if we put it back, how much would that help human services, culture, arts, nonprofits, and how can we get that to stay? We are almost at the end, and I'm going to ask everybody to be really succinct and really impassioned. If you could offer one sentence of advice to the 100 people who are on this call about managing a nonprofit surviving at a time of crisis, what would that be? And Angela, I love that you're looking up in the corner. Steve, you're looking down. Troy, you're looking straight ahead. Troy, I'm choosing you.
Mission. What is your mission as an organization, and how can you deliver that mission today? And how can you best prepare your organization with delivering it a year from now or 2 years from now? We are all going to have to do things differently, but there is going to be another side. We are going to get past this, and the world will have changed. It'll be a little different, but there is another side. It's about keeping your mission forefront and making sure that you're serving it, not just trying to go through the motions of what you were doing before.
Beautiful. Linda?
Yeah, I would say mission, but I would also say listen to your frontline workers, because, we can sit in our office and we can have team meetings, etc., but those that are working day to day on the front lines with directly clients and participants, they've really given us a lot of good information about how we respond as we move through the pandemic, the COVID-19 times. So I would say let your mission guide you, but listen to people who are on day-to-day on the front lines.
Beautiful. Angela?
Those are both two great things, but what I would add is be willing to change, be willing to flex, be willing to respond rapidly, be willing to try new things that you haven't tried before, be willing to plan, replan, and plan again. So instead of writing the 2 or 3 year strategic plans, which frankly I think are usually junk anyway, be willing to really rethink and replan on the fly and try new things very quickly. It actually provides a lot of energy, a lot of innovation, and a lot of things you might not have otherwise if you're just open to it.
Beautiful. Steve?
So I always say that I'm in the solutions business in whatever we're doing, and I think all of those points are incredibly valuable. I'd say stay focused on your mission, stay flexible, stay clear-eyed. Use radical transparency, not just to your donors and to your staff, but to Linda's point, to those frontline workers. I try to email with at least 10 or 20 of our frontline folks every day just to say, how you doing? Because that feedback's really, really important. And I believe very firmly, otherwise I'm not sure I could lift my head off the pillow every morning and do this every day, but I believe very firmly if we do those things, we keep working at it, that we're going to come out of the other end of this much stronger as an organization and as a community.
So I love those answers. And I will admit on Thursday, March 12th, we transformed. We switched. It was our 100th anniversary. We were going to open an exhibit at the museum celebrating our 100 years here. And I believe we were the first fund announced in all of New England. We announced it at 6 a.m. on Friday, the 13th. Great day to announce it. And then we merged. And nobody would have ever thought of that. And with the Greater Worcester Community Foundation, with all of you, the amount of dollars that have been raised, but the good that those dollars are doing. And that's flexible, and that's staying true to mission, and that's listening to people. So the four of you, I could not be prouder to work with all of you. And that's the way I want to end, and I turn it back over to Brad.
All right. Well, we at WJ would once again like to thank Tim Garvin for moderating the panel today. And of course, to our terrific panel for sharing their insight and a lot of great information. Angela, Troy, Linda, and Stephen, thank you so very, very much. And
Thank you.
one more big thank you again to our sponsors, Fallon Health and Webster 5, who have again made this webinar possible to be made for free to all of you attendees. And then one last note, all attendees will receive a follow-up email, including a link to this session. Thank you. Now it's time to get out of the office, out of your living room, your kitchen, or your basement, and enjoy your beautiful day.